The Department of Regulatory Agency's Division of Professions and Occupations, or DORA, provides consumer protection through its regulation of more than 500,000 licensees within more than 50 professions, occupations, and businesses in the state of Colorado. DORA's mission is consumer protection, which is implemented through licensure and certification of health and mental health providers. Pursuant to their respective practice acts, DORA contracts with Peer Assistance Services, or PAS, to provide peer health assistance programs for the State Board of Nursing, the State Board of Pharmacy, the State Board of Veterinary Medicine, the Colorado Dental Board, and the Colorado Mental Health Boards. PAS leads with prevention and intervention for substance use and mental health concerns. Health and mental health professionals throughout our diverse state have access to comprehensive evaluation, referral to appropriate levels of care, and case management. Peer health assistance programs emerged in the 1980s to enhance public protection by promoting earlier identification and intervention before professionals demonstrated unsafe practices. These programs are structured and supportive for healthcare professionals with illnesses that impair their practice. These programs provide evaluation, referral to treatment, case management, and monitoring of the professional throughout treatment and recovery. Health and mental health professionals, like the general population, experience substance use and mental health-related problems. Referred professionals are supported throughout their recovery, maintaining their professional practice while safeguarding the health of the community. Early intervention with these illnesses is critical. Peer Assistance Services provides an effective model for recovery and return to practice for those with substance use, mental health disorders, and other practice-affecting issues. Through evaluation, treatment, and monitoring, individuals can regain their lives and livelihoods as trusted health and mental health professionals.
The end result of addiction is death. And we've had way too many of my colleagues that I've known that are not with us anymore because people were afraid they were going to get them in trouble. And that's totally unacceptable to me.
Peer assistance services is a chance to get better and to literally save your life.
In my addiction, I had problems with depression and, considered suicide, and no one ever used to talk about it before.
We need to ask for help, and it's very difficult for us to do. And I think I find that in most of the healthcare professions. We're all really high achievers, and we got there through a strong drive to succeed.
For me, this is what's going in my mind. I'm a pharmacist, I'm a professional, I should know better. My life will be over if I ask for help.
I got busted diverting and was referred to peer assistance.
I was working in a pharmacy. I was diverting hydrocodone. I couldn't stop obsessing about it. So I knew I was truly addicted.
When I moved to Colorado from Michigan, when I applied for licensure here, they asked questions. Did you ever have a drug problem? Did you ever have an alcohol problem? Peer Assistance was contracted by the Board of Dentistry to evaluate and monitor people with past history of problems. Monitoring contract with them for 3 years. I had to do all sorts of things that helped strengthen my recovery.
Generally, you get an evaluation, referral for appropriate treatment if it's indicated, and then peer is a monitoring and accountability/support program that lets the board know that you're still doing the things that you need to do to treat your disease and that you're safe to work.
Being able to connect with others and build that support system, it can be challenging in a rural community. Not everyone thinks of being in a monitoring program as something that's great, but I saw it as an opportunity. I knew I needed help, and I was glad that there was people in a program set up to support me.
Random drug tests, alcohol tests. I had counselors that I had to see. I had recovery meetings. I found it to be very helpful. And so when I graduated from the program, I stayed on to help and became the point person in Colorado to answer the phone when somebody calls.
They've been trained specifically for the issues that we face. compassion fatigue and forgetting to take care of our own needs as healthcare workers, because we're so apt to put the needs of others before ourselves.
Peer assistance held me accountable. Otherwise, I wouldn't have gotten well.
You don't just have to take my word for it. Like, here's evidence that I'm safe to practice and I'm a good nurse who has a really wicked disease. And if anyone should understand that, it's people who work in the healthcare industry.
Without a supportive program, people won't come forward. The only way for people to get help who are in the healthcare profession would be punitive measures. And you get arrested at work. That's a bad day.
We do recover. People do recover. They do get better and they do get their lives on track.
It's a disease, but I did not think that then. I know that now. Peer assistance was a lifesaver for me.
They were there to ensure that I will not only practice at the highest level, but they wanted me to live my best life too.
We're at Northfield Veterinary Hospital, and I am the owner and lead veterinarian here. This is my project and my baby. I'm very proud of it. I would hire a peer assistant graduate in a heartbeat. They really do allow people who have struggles get back on their feet, to get back into the profession that needs them.
This is a brain-based disorder. Evidence-based treatments are available. Nurses and others can recover. They can return to the workforce and they can be healthy, productive members of providing that health care.
I got sober in 2001, so I started out as a client of Peer Assistance Services. I was able to be supported through an amazing organization like Peer Assistance Services, and I was able to get my life back on track. And I just like to think that the world's a better place because I was willing to fight for it.
We have very little in the nursing curricula that prepares nurses to work with this population of individuals with mental health and substance use disorders. If we're not integrating this into healthcare practice, an evidence-based intervention that's not being widely used to prevent that progression of substance use, and if we're not testing on the exam, then we're not doing a justice to preparing nurses for the future to care for this population.
Sometimes you just have to be willing to give people a chance because they can be your best, most dedicated, emotionally vested people that you could ever have.
Stigma continues to be one of the largest barriers for people seeking treatment, oftentimes even acknowledging that they might need treatment. What I'm trying to do with the neurobiology is shift that paradigm to understanding this is a science-based paradigm. And nurses are not immune to those prejudices.
If you hire somebody who's under contract with Peer Assistance Services, you're actually getting somebody that you can trust because they're being monitored by the board and by Peer Assistance Services. They have to undergo a lot of testing and they have to undergo a lot of counseling. There shouldn't be the stigma associated with addiction and mental illness. We're all just people with a disease and we all need a chance because we can make beautiful things happen.